This program is brought to you by Stanford Hospital and Clinics.
Thanks very much for coming to see me today about your lymphedema. I know you have lots of questions, so I'd be happy to try to answer them if I can.
Thank you. I do have a list of questions. My first question is, if a person had swelling of the arm after surgery, how would they know whether or not that was indeed lymphedema?
Well, of course, we never know for sure, and there may be a variety of reasons that someone could have swelling of a single arm or leg. In the setting of breast cancer, we get very concerned that it might be lymphedema because we now have a provoking cause. But it's not the only reason that breast cancer survivors get arm swelling. So in that case, it's very, very important to seek the input of a healthcare professional who might do tests or certainly a physical examination and try to determine what the cause is. Of course, very likely it will be lymphedema.
Is that time critical in any way? I mean, once a person has suspicion, are they supposed to act on that right away?
I think it is important, and we have lots of evidence to suggest that the duration of lymphedema will determine its responsiveness to treatment and its severity. So at the earliest sign that there may be a problem, a healthcare professional should get involved so that whatever can be done, and that will help to limit the problem.
Is it sometimes painful?
Lymphedema is, in fact, painful in quite a number of cases. It's a little recognized fact until one looks at the results of series of patients. And in fact, we see that lymphedema patients quite frequently report discomfort and other physical symptoms that could be interpreted as pain. So it can really be the source of symptoms beyond swelling.
What particular kind of doctor would I contact if I had suspicions or?
Well, there's a little bit of a problem because I think that there are unfortunately not enough doctors today who know enough about lymphedema to necessarily help patients. I think starting with an internist or a family practitioner or whoever the primary care provider is would be the best approach. If that doctor can't help, then one has to begin a search in the region in which the patient lives, looking perhaps for an oncologist who might specialize in this area, a physical medicine doctor. I'm by training a cardiologist. There are some cardiologists who are interested in lymphedema, a surgeon, sometimes even dermatologist. One has to really do a fairly aggressive search if the primary care physician can't help.
Thank you. Can you tell me a little bit about the treatment for lymphedema?
Lymphedema is treated through physical means. The lymphedema causes an accumulation of fluid in the tissues, and in order to mobilize that tissue, we have to stimulate the lymph system to be more active. The complete treatment is called complex decongestive physiotherapy. Sometimes we call it CDPT, and it really means that there is a suite of interventions by a therapist that will lead to a reduction in the size of the arm or leg that's affected. Basically, they include a number of components, one being a particular massage technique that is very useful to mobilize lymph through the lymph system. A second is multi-layer bandaging. We give instruction on exercise, instruction on skin care, and eventually we fit the patient for a compression garment that will sustain the benefits of the acute interventions by the physical therapist once the arm or leg is down to as close to normal size as can be achieved through treatment.
Can you tell me specifically about MLD and what that means, how it works?
Of course. So MLD is an acronym that stands for manual lymphatic drainage, and it's a technique that was discovered quite by accident about 75 years ago. It was actually discovered by a cosmetologist who was looking to treat cellulite, and he discovered that while it didn't work very well for cellulite, it does actually stimulate the lymph system to be more active. It stimulates the contraction of the lymphatic channels. And basically it is a very light and directed stimulation of the skin that opens the lymphatic capillaries and encourages them to take up fluid. This is not something that can be done intuitively. A therapist who does manual lymphatic drainage or MLD has quite a lot of training to learn how to do it correctly. Patients can be taught how to do this in a self-massage technique, but it's important that it be done under the guidance of a therapist who knows how to guide the patient.
So is it the therapist that actually treats the lymphedema, or is it a doctor? Or?
Typically, it is a therapist, and the therapist will do all of the components of CDPT. Usually, each session of physical therapy will include 15 to 30 minutes of the MLD massage. Then a multi-layer bandage will be applied, and that typically takes 30 to 45 minutes to put in place. Again, quite an intricate set of steps to make that happen. Typically, the patient wears the bandaging material home from the therapist's office, if possible overnight, but certainly for the remainder of the day. And that sequence is repeated, depending on the patient's severity of lymphedema, 15 or 30 times successively. And with each application of the bandages, there will be a slight additional reduction in volume. And when that reduction is maximal, when the limb stops getting any smaller, that's when the therapist will measure for the garment, which will then be supplied to the patient to be worn on a daily basis. So the bandaging is done only by the therapist in the typical application. MLD is done most effectively by the therapist, and if necessary or desired, the patient can learn how to do the MLD at home once the sessions with the therapist have ended.
And how would a person find a therapist, and is it possibly covered by most insurance?
So finding a therapist can be a little bit of a challenge, again, because there are not enough well-trained therapists for lymphedema across the United States. There's a maldistribution of therapists. Some areas have many, some areas have few to none. Therapists come from a variety of training backgrounds. They can be physical therapists or occupational therapists. They can be nurses. They can even be massage therapists who've gone for additional training. The important element is to be certain that the individual has had specific training in lymphedema treatment techniques. This is not the kind of massage one gets in a health club or a gym. It's not an athletic massage, and it must be done correctly, and it must be done under appropriate supervision. It's best to look for a therapist who works closely with doctors so there can be a good dialogue between the doctor, in this case your doctor, and the therapist. One should look into the training background of the therapist, and if possible, one should get some local reactions from other patients who've been treated to talk about the success or lack of success in the intervention. There are some resources for information on the internet. For example, there is an organization called the National Lymphedema Network that provides directory resources to find therapists in various locations in the United States, and there are others. It's not a simple task always to find the right person, but their information is out there, and we at the Stanford Center for Lymphatic and Venous Disorders also have resource lists, and we are happy to help patients who contact us directly.
And does the insurance usually cover it?
Insurance is variable. In the case of breast cancer, there is something called the Breast Cancer Act, which included language approved by Congress that states that all patients who have been treated for breast cancer are entitled to care for lymphedema associated with breast cancer. That unfortunately doesn't cover all costs associated with lymphedema care, but it will cover some element of the interaction with the therapist. It doesn't always cover the cost of the garment. In fact, very often it won't. And unfortunately for other cancers that also cause lymphedema, like cancers of the female organs, cancer of the prostate, lymphoma, and malignant melanoma, there is no parallel congressional language to assure that patients can get treatment. So it is a problem in our healthcare system that needs to be rectified, but there is insurance support for a lot of this treatment when it's necessary.
If a patient thinks that the treatment is not working well, is there something to be done about that?
Well, sometimes, unfortunately, lymphedema doesn't respond very aggressively to treatment, and we have to remember that in some cases, if it isn't responding, it isn't, so to speak, anybody's fault. But I do want to emphasize that the lymph treatment that's done by the therapist is as much an art as a science, and there are two people involved. There is the patient and there is the therapist, and sometimes the work of one therapist simply is not ideally suited to a given patient. And I would strongly encourage a patient who sees a lack of response to try perhaps another intervention with another therapist to see if that will net better results.
Some of the supplies that you mentioned, the wrapping and the sleeve and stuff, where would you purchase things like that?
Well, there are resources again on the internet, and those same sources of information can provide information about where to make purchases online. The benefit of that is that sometimes they're cheaper than what can be purchased in a medical supply company that is providing materials by retail. I think the drawback of internet purchases is that the sizing of the garments is very, very important, so that I think using that as an initial resource may be fraught with some difficulty. But once a patient has had recurrent purchases of a garment and the sizing seems to be pretty standard and the particular manufacturer provides a garment that seems to work, then I think looking for an internet source that might be cheaper is reasonable. So the starting place is the therapist, who will typically guide the patient to a local retailer for the initial purchases, and thereafter perhaps internet resources can be utilized.
Do you recommend pneumatic pumps? I don't even know how those work, so...
Again, a good question, and a question that's fraught with some difficulty in the answer. All pumps are not alike. That's number one. And it's important that the pump mechanism be appropriate for lymphedema, because pumps are used for a variety of medical indications in medicine. Number two is pumps are not standalone treatment. So earlier when you and I were talking, we talked about CDPT that had all those components in care. Pumps do not take the place of those components, but can serve as an adjunctive measure to those components. So sometimes a therapist will choose to use a pump in the office, interwoven with the massage and with the bandaging and all the other things that are done. Even if the pump is not used in the acute phase of treatment, once the patient goes on to using a garment, possibly with use of MLD at home, the patient may find that really he or she is not satisfied with the results, and sometimes adding in a pump to those basic measures will net further improvement. I particularly favor pumps that are multi-component, so at least 6 to 10 individual segments that inflate and deflate to provide the pumping action to the arm or leg that's involved. It's very nice if actually the pump will simulate what MLD does, and there are such devices on the market. I'm very anxious that patients not use pumps at high pressure, so we definitely indicate to our patients no more than 60 millimeters of mercury applied, and we prefer something closer to 30 millimeters of mercury, and no longer than 1 hour at a time in a treatment sequence. This is not like milking a cow. It's a very different approach, and it will only work if you're really working with the lymphatic system. So pumps can be fraught with difficulty. This should always be done under the guidance of a healthcare provider. It should always be woven into the other care, and pumps are not for everyone.
Are there any drug therapies that work for lymphedema?
At the moment, embarrassingly few. There are some that have been promoted. For example, there is a systemic drug called coumarin that has been advocated, particularly internationally. Unfortunately, the Food and Drug Administration has not approved this for use in the United States because coumarin, while it does improve lymphatic function a little bit, also is toxic to the liver. And therefore, I don't recommend that patients go to international sources to get it. There is an over-the-counter substance, which is horse chestnut extract that can be bought in commercial pharmacies, that actually has a long track record of being very effective in vein disease. And because vein disease and lymphatic disease often coexist, and because the veins and the lymphatics work in a partnership in the body, often stimulating the veins to be more effective will actually help lymphedema. So I do encourage my patients to consider taking horse chestnut extract. It really doesn't have any side effects that are worrisome, and it may be helpful to a small degree. There are no other drugs that can be given by prescription, but I will say that in our research work here at Stanford, we're actively looking for drug therapies that do work, And in mouse models of human lymphatic disease, we find that we have some promising drug classes that may be developed in the future. So everybody who's watching this video clip should hang on and hope that in the future we have a better answer.
Excellent. How about surgery? Is that an option?
There are some surgeries that are an option. Many surgical approaches historically have failed for lymphedema, so that many that have been promoted in the past are no longer used. One that we do use here at Stanford, and that has been used increasingly and now extensively in Europe, is a liposuction technique. Again, it's not for everyone, but in some cases of long-standing lymphedema, the fluid accumulation that makes the arm larger is eventually replaced by fat. And fat-containing cells behave very much like fluid in the limb, but it cannot be displaced. And so the typical techniques of MLD and pumps and use of compression garments will not encourage the limb to get any smaller, because the fluid that's filling the limb is actually fat that's packaged in tiny, millions of tiny cells. But those cells and their fat content can be removed surgically in a very safe general anesthetic technique. It's not to be undertaken by somebody who doesn't have specific experience in treating lymphedema surgically, but here at Stanford and at a couple of other centers in the United States, and now many in Europe, this can be done, and it can restore the limb to normal size in the properly chosen patient. However, the caveat is, for any patient to have this surgery, they have to wear continuous compression in the form of a garment after the surgery is done. They will get a normal-sized limb, but it will quickly blow up again if that limb is not compressed with a garment.
Sounds exciting, though.
It's exciting. We're hoping it makes an impact for the selected patients.
Good. I've heard that sometimes the breast itself can be affected by lymphedema. Is there anything to do about that?
Yes, the breast is surprisingly commonly affected because the breast shares the lymphatic drainage that is supplied to the arm as well. So everything pretty much drains into the armpit region. Medically, we call it the axilla. And sometimes the breast tissue itself can become swollen with lymph. There we do have some techniques. We don't have quite as much to offer as we do for the arm, but MLD works very well for the breast, and there are actually breast compression garments as well. So basically they're bras, very similar to a sports bra, but one that will provide direct compression to the breast after it's been decompressed with the manual lymphatic drainage. Some of the pump devices that I mentioned will also work in the chest region, and they can be used in an augmenting fashion to the MLD as well.
Thank you very much. I learned a lot from your answers.
Great. Thanks so much for your questions.